Welcome to Mercy Health, St. Rita's Medical Center, Emergency Medicine. The Lima-Allen region welcomes you and invites you to find a hidden gem in emergency medicine residency training. Our Emergency Medicine Residency Program operates as a vital part of a regional trauma center, as well as multiple regional specialty care centers, serving the surrounding 10-county population of over 1.5 million individuals. St. Rita's Medical Center has a 100-year-old tradition of high-quality medical care and innovation in the region as the highest acuity hospital and main center of reference for hospitals in the area, offering specialized care in multiple areas of healthcare, starting with the emergency department. While located in what is considered a semi-rural area, St. Rita's Medical Center commonly surprises those who visit us for the first time by providing the same acuity and level of care one would expect to find on a city hospital, mixed with the warm welcome of the Midwest hospitality, known in the region as Lima Nice. St. Rita's also hosts internal medicine, family medicine, podiatric medicine, and pharmacy residencies, and over the last few years has received the Modern Healthcare Best Places to Work Award and the Watson Health's Top 100 Hospitals recognition for several years in a row, in addition to being one of the very few hospitals in the nation to hold a magnet certification and a CMS 5-star classification. In this video, you'll get to meet the members of the residency team, the residents, and take a tour of the emergency department and be introduced to the emergency department staff. We're all excited to talk to you more about the Emergency Medicine Residency Program here.
I think we want to look for a candidate who is, let's say, multi-talented. We want somebody who has the inquisitive nature to want to keep learning and get better each and every single day.
So as a new program, we look for people who want to start something new, people who want to trailblaze, who wants to create a new path and leave a legacy behind them.
I think candidates we're looking for here are ones that are really looking to learn and grow and develop in their education to become excellent emergency room physicians. We have a great team here. We have great complexity when it comes to patient acuity. We have great volume of patients, and so I think it's a great environment for somebody that's really energetic, eager to really learn to be an outstanding emergency physician.
What we do is we structure the learning experience for our resident physicians by making sure there is a 1-to-1 or 1-to-2 ratio between faculty and residents at any given time. We will make sure to see every patient that the resident sees, especially in the first year and a half, and really give them honest feedback after every single shift.
Here at St. Rita's, we're fortunate to have a very large area of coverage. So we have a very large population of critical patients.
Our market here at St. Rita's is about 10 county-wide, and so we reach out into the very rural populations. There's a lot of small community-based hospitals that are out in these counties that really partner with us and rely on us for that next level of high acuity critical care.
That for training is fantastic. It comes along with procedures, it comes along with critical care, it comes along with exposure to many things that you may not get exposed to in a larger city.
We really want to be, and we really are, the preferred hospital of choice and medical center and referral center for really that space between Toledo to the north of us and Dayton to the south of us. We're a pretty busy emergency department. We routinely see about 55 to 60,000 visits annually. We admit about 25% of those patients, so it's really a high volume, high acuity, high complexity type of emergency department.
The GME Center, right behind me, is being built right now and will be ready for you to use it very soon. All the funds to make this big new facility come from the support of our community, and that reflects on how we support our community here as well.
The Emergency Medicine Residency Program I think will benefit greatly from the GME building and the center. Not only is it set up for education of medical students, nursing, resident physicians, it is also set up for simulation. We're going to have a wet lab, we're going to have a simulation setup over at the GME Center, and it really will be a focal point for our program.
It's hard to encounter everything you will see throughout your career by doing shifts in the emergency department. So simulation is a key part of training in emergency medicine?
We definitely emphasize wellness in our residents, not because we're just paying homage to the requirements, but we really believe in it. I think wellness is important. Mental health is important.
You can also train to be well, train to be well rested, and to incorporate all those good practices in your day-to-day life as an emergency physician.
I think all ERs that run well have to have great teamwork and have to have a great culture. It starts really with the relationship between our nurses and our physicians and now our residents. And so as we've begun our residency program, we've really grown to include them as part of that culture and part of that team atmosphere that we have.
One of the things that surprises many people is encountering a big hospital, somewhat what they would expect to see in a large city, but here in Lima. So having nice people, having very sick patients, having exposure to a lot of procedures, but in a very relaxed environment where you can talk to each other. It is very common for large academic centers to not be as collegial. Here, we're big about that. We're big about talking to each other. We're big about being able to work together and have the patient as the center of our efforts.
I really love Mercy Health. I think the mission statement, the vision of the ministry is entirely aligned between the clinicians, the nurses, and really the main emphasis is to heal our patients.
For me, this was my top choice. This is where I wanted to be. I wanted a fresh new program that offered a lot of help to its local citizens. For me, this is a place that made a huge impact in the community. It's an amazing ER, highly equipped with everything you could ever want. It's got a patient population that is full of different diseases and things you want to see at emergency medicine that make it exciting. It's different every day. Once I visited here, I kind of fell in love, and really after that it was kind of just, there's nowhere else I wanted to be, and so this just kind of felt like home for me.
Mercy Health St. Rita's is a hidden gem. This residency program has been wonderful. When I first came for my interview, I realized how intelligent and kind the faculty and the administration are here.
My interview here, I got to meet the program director, Dr. Toro, Dr. Chan, the APD, and Sue, the program coordinator. Everybody was incredibly friendly and welcoming. They introduced me to many people throughout the hospital who shared that same idea of welcoming and nurturing nature.
For me, finding the perfect fit for residency was a lot about trying to find something that was individual as a fit for me. So that included thinking about the location, thinking about the opportunities that I would have in the residency, and then also thinking about the general feel and vibe of the existing staff at the program.
I was really excited to match here at St. Rita's because I had such positive interactions with everybody on my interview day. I found out that I'd get to be working one-on-one with attendings, and I could really tell that everybody was very excited to have all of us here as residents and give us the support and training we need to get where we want to go, which is graduation day and a board certification in emergency medicine.
On a day-to-day basis, the physicians will teach you at your level, so they'll teach you hands-on. You get to learn about gyroscope right away, fast ultrasound, you get lots of experience just hands-on. Then overall, you get experience with leadership, opportunities for management, opportunities if you're interested in toxicology. Every day there's something new to learn about, and depending on what your specialty that you're kind of looking more to subspecialize in, there's always an opportunity to go there.
So resident doctors are treated as valued members of the healthcare team. Initially, it was kind of jarring to hear myself called doctor and to try to step into the shoes and the role of resident from transitioning from medical student. But everybody here in the emergency department, the staff and the faculty here have been really great in helping me fill in this new role.
I'm treated here with so much respect. My staff members treat me as one of their own, whether that's from my attendings to the nurses who help guide me and teach me things through their own ways. It's been incredible. I've never felt disrespected here. I really do feel like part of the team. Like I said, they mean it when they say Lima nice, and it's a true thing. I really do feel welcomed every single day I come here to work. It's a pretty unique experience that I've never experienced in my life, and so it's nice to come to work every day and just feel lucky and blessed.
They've been really open-eared and open-minded with any suggestions that I have. If I have recommendations, they're quick to implement them and try them out to see if they better the program, better the experience, and better the learning.
The best part about this program really is the people who are here. Not only do we have great administration and our program director and our assistant program director and our amazing coordinator, we also work with a great team of nurses and staff in the ED. And so much of our day-to-day work environment is based on those staff in the ED, and they are just the sweetest people, and it makes our lives so much easier.
The community is great. Everybody here seems very open and supportive of the residents. We have our own little fan club, it seems like, from the nurses up to administration. So it's a nice, welcoming place to come to, and it helps every day, kind of helps you to learn and get more comfortable with your role.
It's kind of a small town vibe with the essentials, if you will. There's plenty of travel to do around big cities that are close, wonderful hiking. Really, it's an area that will allow you to do what you will.
And I love the fact that we have big city pathology with a small town feel to the city. And I really appreciate being close to a bunch of large cities like Chicago, Cleveland, Columbus, Cincinnati, and having access to those larger city regions while still living in a small town community.
My experience here has been unparalleled. I mean that in every way. It's since day one, some of the things we've done here and seen here, it's truly been incredible. Some of the procedures that I've been able to do at my stage in training have just been amazing. It's different than most of my colleagues in other programs across the U.S. I feel much more advanced than other residents at this point, just because of the opportunities that I'm awarded for where I am and the amazing opportunities that my attendings give me. You always know that you have someone who has your back every single day.